After a 5 kilometers walk and workout, we spoke to Vinita Otieno, a lupus survivor. She tells us her scare when she was told that she has lupus, a rare condition, inflammatory autoimmune disease, where the immune system mistakenly attacks the body's own tissues and organs, causing a widespread inflammation and damage.
But here came this disease, and the only people I knew about lupus were actually dead. So I was scared. I didn't know how to react. I ended up in hospital. I had 1 platelet. I had 2 brain bleeds out of nowhere. So began the long test. It was quite a long journey. It took between 4 to 6 months to finally be able to diagnose it. It showed up with exhaustion. It showed up with blood. I had blood in my urine, I had blood in my spit. So by the time I was diagnosed I was chronic. You know, like I say, I had 1 platelet. The minimum is 150,000.
The situation is the same for Aruk Sheikh. She tells us how lupus manifested in her.
Growing up, I had all kinds of really weird issues. I had chronic constipation, chronic UTIs. I had a UTI almost every month, which is a urinary tract infection, which means I had blood in my urine and pain. I had gastro issues, a lot of acidity. My nails used to break. I used to have a lot of hair fall. But I think the biggest and most weirdest alarming symptom for me was a really severe migraine on this side of my head, and it just wouldn't go. So I had a migraine for 11 days and we went to the hospital. The doctor looked me in the eye without doing any test and said, "I'm 99% sure you have a brain clot." I did not have a brain clot.
Just like any other chronic illness, lupus patients live on medication.
Treatment for lupus, primary treatment, is immunosuppressants, because we have to suppress your immunity to be able to allow your body to thrive. So you're on immunodepressants, I'm on HCQ as well, and steroid treatments. And this is a lifetime of taking medication. Based on a flare-up happens, you feel exhausted, a flare-up can attack you, and you don't know which organ it will attack. So mine repeatedly attacked my platelet.
We also spoke to cancer patients who insisted on the need to create awareness around chronic illnesses. They tell us that denial and stigma is a major setback.
I call myself Mama Matiti Moja because that is the hard reality. And it didn't come easily, because once you get a cancer diagnosis, there is that aspect of denial. Mentally, emotionally, and financially, there's a very big constraint that happens. But it took a while, but I agreed and bought to it. Why do I say this? So that people can stop denying.
And another reason why I'm here is to show everyone that there is life after cancer, and we can live a normal life, and also to emphasize the importance of early detection and also embracing a healthy lifestyle.
I'm a cancer survivor, that is leukemia bone marrow transplant. I am celebrating like 7 years now down the line, and what I can tell people, I would like to give people hope. Once you get diagnosed, not the end of it all. You just have to start from here. It's mind game.
According to experts, early diagnosis and regular checkup can help one fight any chronic illness.
So like any other chronic illness, like heart disease, heart hypertension, it's the same prevention. It's exercise as often as you can, balanced diet, regular meals, sleep, at least 7 to 8 hours of sleep if you can, and then manage stress. That cuts across all chronic illnesses, and that's a good way to prevent mental illnesses as well.
There are those who are at a higher risk than others, particularly those who've had a family history of, like, let's say, diabetes or high blood pressure, or even cancers. So if you have a high family history of these conditions, you need to get screened earlier compared to someone who doesn't have. And then people with excess weight. Excess weight is considered like the mother of most non-communicable illnesses. So managing your weight, looking at how you eat, how you exercise, dealing with stress and sleep, all those things influence weight. And then, of course, early screening. Early screening is important because the earlier you catch it, the better you're able to treat it and to prevent complications.
The government and relevant stakeholders have to this end been called upon to ensure funding towards fighting chronic disease.
Government itself is so focused on other diseases, and looks like they have this space of chronic diseases have been ignored. we want that to be mainstreamed. So, because this is the lowest of the hanging fruits, these are things you can tell people about fighting obesity, about diet, about just lifestyle. So I think that is why we are going to be very vocal and engage with patient groups so that they can have a voice and talk to government so that this becomes it's taken as serious as we have seen malaria and other diseases.
The reason we have the burden of late diagnosis, especially in Kenya, from our analysis and our data across all the counties, is because people are afraid to find out they have diabetes or cancer because they might not be able to afford treatment.
Present for the walk and awareness event were fitness coaches who insisted on the importance of a healthy lifestyle.
Our main agenda leo ilikuwa kuonyesha watu kuwa fitness ama mazoezi ni kitu very important while managing these chronic diseases, na pia kusaidia kuprevent usipate, because some of these diseases tunapata kulingana na venye our lifestyle, yani vile tunaishi na vile tunakula and all that, si eti tumezaliwa nayo. So sisi kufanya mazoezi ni vizuri ili una burn calories na unapunguza weight yenye fat yenye haitajiki kwa mwili, na pia unasaidia for blood flow and just being active.
Reporting for K24 TV, my name is Robbie.